George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. Dr. Ofrona Reid was the Chief Medical Officer of Syracuse Community Health. Now, congratulations in order, because he is now the interim president and CEO of Syracuse Community Health. Good to see you, Doc.
Good to see you too, George.
So this is a great time for me. A great time for you in the community. Tell me about this new role and what you're looking forward to the most.
I think, I look forward to continuing with, providing the best quality of care to our patient population. But this role kind of changes my scope of how I move daily to day, because now it's more so for me to get involved with community, meet community leaders from different healthcare settings, from the senators to, assemblywomen and men, and just kind of really trying to connect and partner with outside organizations besides, what we have now.
You've been in practice for all of these years. Will this mean that you won't be practicing at all?
No, so I put together a really strong support team as far as senior executive team and directors. So I will still be seeing patients 1 day a week. That will not change.
Was that something that was that like part of the package?
Yes.
Why was that important to you?
I think it's important for a couple of reasons. How you want, it's almost like street credit. When people see you doing the same thing they're doing, you can understand the challenges. You can understand all the barriers and what we face from day to day in the healthcare setting, in the clinical setting. And I think that people could have a better understanding of when I do have a direction or a plan, they will get easier buy-in because they know that I'm actually living what they're living. And so you'll normally get a better surrounding as far as clinical staff buy-in and support, and that's how you can move the needle in that fashion.
You've been medical director of other facilities, not just Syracuse Community Health. Tell us about your background.
Yeah, so I was the chief medical officer for Oneida Health for 5 years. I was the medical director for the nursing home for over 10 years in Oneida. So I held many medical directors positions in a couple of nursing homes, and even in Syracuse over the last 10 years or so.
And you, let's talk about you're the interim CEO. What can we look forward to there?
I think what you'll see is that you will see a more of a public health approach. I think because my clinical background, I really think about public health. And so you'll see Syracuse Community Health Center involved in a lot of public health initiatives, partnerships with the Department of Health, and things of that nature.
And you indicated that this is important to you to maintain your clinical practice. What your practice? What is your background? What is your area of specialty?
Yeah, I'm a board certified internal medicine physician.
That's what I thought. Just want to reiterate that. Yeah, and so you're seeing adult patients, and helping them get the best help they can need, that they need. One of the things that we think about and the role of community health centers is about health disparities and what to do about that. How does the Syracuse Community Health see its role as a center that is specifically designed to increase health access?
I think the key thing is right, increasing access. So what we do have now, we have our quick care open. Quick care is open on Saturdays now from 12 p.m. to 8 p.m. and it's open Monday to Friday from 8 a.m. to 8 p.m. So you can walk in anytime with any problem and you can get immediate care. From there, we can actually refer you to one of our providers, whether it's OBGYN, whether it's pediatrics, whether it's internal medicine, whether it's family medicine, whether it's dental, behavioral health, substance abuse, eye care, foot care. That's the avenue where we could actually have patients followed up after they've seen in quick care. We also have walk-in hours in our OBGYN department, our pediatric department, as well as our optometry department, eye care department.
You just had a brand spanking new addition. Talk about that.
Oh, it's been amazing. It's about health equity. The fact that this community has a health center with the state-of-the-art technology, state-of-the-art equipment, exam rooms like no other. I think that this speaks highly of our commitment to health equity in our community. They deserve the best.
So tell me about the facility you have there now.
So it's about 33,000 square footage, I believe. We have 39 exam rooms. We have a women's health center, is the state of the art. We have radiology, which includes ultrasound and X-ray. We have a whole eye care center, which includes not only an eye doctor and eye care, but we have an eye care dispensary where patients can come in and get their glasses and their lenses. We are the only place, one of the only places, I think Camillus has one eye center that takes Medicaid. So we actually take Medicaid patients who are able to come in, get their eyes checked, get evaluated, and leave with a pair of glasses and frames at an affordable price.
Dr. Reid, you also, so in terms of the two buildings now, what's the old building on 819th being used for, and what's the new facility, which is across the street?
So 819, our former main site, we still have our behavioral health services, which cover mental health and substance abuse. And then we have our quick care, which is a walk-in care on that side. Our finance department and our HR department is still in 819. On our new 930 site, we have our internal medicine, our family medicine, OBGYN, we have pediatrics, radiology, eye care, and dental. We still have our dental walk-in care at 819. That same day service, that remains at 819.
So you can go in. I think it's really exciting for the community. What about this interim CEO label? What about that?
Well, I think it's interim right now. I think sooner or later it'll be permanent. I think that because of the transition that took place with the loss of Keith Cutler, the interim was the best way to go for myself as well as for the organization. But I feel very confident that it'll be a short interim period.
I mean, what excites you most about the opportunity that you have now as the CEO, interim CEO?
I think being a medical doctor and having administrative abilities and to be able to go out and talk to hospitals like Krause and Upstate and St. Joseph, who, most of them have leadership MDs, and they'll have those conversations about collaboration and working together, partnering with them. We may have a little bit more pull, a little bit more strength because we all understand one another from going to medical school and taking care of patients. So I think that commonality is what's going to help us grow in 2024 moving forward.
You talked about the collaborations with the other medical providers. When I went to the open house, they were all there, and I thought that was exciting. Is that because why is that? Why is that important to have these collaborations with these other health care facilities? I mean, it seems like a no-brainer, but why would you put that in perspective?
Well, I think that we have a patient population that, as you mentioned, has healthcare disparities, who has issues that require cardiologists or endocrinologists or a neurologist. And, those health systems have that specialty that we need. We also work with them to decrease their, rehospitalization rates, as far as, admission rates and ED visits by having patients being seen by us. So they're not going back to the hospital. We have this continuity of care connection with these hospitals for the transition from when the patient is being discharged and by the time they get discharged and when they see us. So closing that gap helps them as well as it helps us. It's very expensive when patients go back to the hospital because now, with all of these different rules and regulations, the hospitals get penalized. So I think we kind of have to work together to not only decrease costs of healthcare, but also to really take care of the patients in a continuity fashion.
You have obviously an MD. Did I also see that you have an MBA as well?
I have an MBA and I also have a master's in healthcare leadership.
So you've been in school for a minute. How is it that you've been able to, what's been your drive? Were you always interested in being a doctor when you were a kid?
Yes, I was always interested in being a doctor. Actually started off wanting to be a foot doctor. And then when I took biology, learned the whole body, I decided I want to be a medical doctor.
Right.
And that drive, I think was for me, I think, growing up and not having a lot and realizing that if I worked hard and became something, it was a way out, of what we call the ghetto. And so the more I worked hard and realized that I could succeed, it was almost like an addiction to continue to do well, to succeed. And so trying to be the best that I could possibly be, was a drive for me.
When you think of so where'd you go to school? Where you go to, like, elementary, high school, college, and all that?
So I went to elementary, high school in Long Island, New York.
Mm-hmm. And it's funny because I'm interested in. Oftentimes we have friends, and at some point, well, you said you were from a. You said the ghetto. That's what you said.
Yeah.
So, how did you leave the folks behind who you had to leave behind to get what you had to do? Like, what happened? How did you make that transition?
I think once I got to college and I got away from all the noise, and when I went back, I realized I was different. I didn't feel safe, or I didn't feel. Prior to that, I felt like I was on. I wasn't afraid of violence. I wasn't afraid of a lot of different things. I was so exposed to it. But when I got away from it and I went back, I realized I was more vulnerable because I haven't been exposed to it, and so that kind of kept me away. So on weekends, instead of going home, I was staying on campus. And then so as time goes by, you go home less. And then
Hmm.
when you do go home, you really feel more vulnerable because you don't have those same street senses that you had before. You
Yeah,
know,
spidey senses. So where'd you go to college?
I went to college, Manhattan College in the Bronx.
Hmm. And then med school.
Then I went to med school, Rush University, which is Dominica.
Hmm.
And then I went to got my master's, both masters at Cornell University.
All right. So you've been busy, right? You've been busy.
Yes, yes,
And now you're the president CEO. I mean, this is exciting for you. Um, and you're a great member of Omega Psi Phi. I just have to say
yes,
that just
yes.
because, Q time, Q team, right? Um, this is, I mean, I guess it's a new era for the health center, right? You know, Mark Hall retired last year, retired from that, I should say, or whatever. I guess you call it retired. I mean,
Yeah.
uh,
Resigned from here, yes.
yeah. And so, and now you're positioned to really be ready for the next phase. What do you think the impact of? Lastly, what do you think the impact is of Micron on this community as it relates to the work that you do?
Well, I think that from my understanding, Mark Hall is actually part of their advisory. So they do see the benefit of focusing on social services of health in the community. So I think that I don't know the details of Micron, but I do know that they are very interested in Syracuse Community Health Center and helping out with any type of service of health issues. But I think anytime you bring a company that's going to increase jobs and people are going to be working, it's going to increase the economy. It's going to change the environment around you. As far as work and economics. So I think it has a great impact on us.
Before let you go, I guess I have to ask you for some medical. I want to call it advice, but I'll say this: the advice upon which you should rely should come from your own medical provider. Okay, so now having said that, right? Did I do that well?
Yes.
um, Healthy. Everybody's trying to think about being healthy. There's the weight loss pills, not pills, Wegovy on Zempic or whatever it is. You know, so what are your suggestions of people? Because a lot of people always want to change their body for 2024 as an internal medicine physician. I've asked you this before. I ask you again. What do you recommend people do? Do you recommend those drugs for people?
Yeah, I do. I think I recommend a combination of those drugs along with exercise and dieting. I've seen the effect of the combination of all three, and I've seen some amazing results. So
Hmm.
I do recommend those medications, especially in patients who have high risk for mortality, morbidity based on, that they have diabetes and overweight and they have cholesterol. So I do recommend that combination of
Right.
both the medication, diet, and exercise.
And exercise. So your advice to people watching, whether are they just want to reconfigure their body, your suggestion is to do what?
I think it'll be diet, exercise, and if you reach a plateau, you could always look at trying to look for other things like Wegovy to help assist. You can't meet the goals.
Appreciate that. All right. Anything else you want us to know about you as the interim CEO of Syracuse Community Health?
No, I just want the community to know that Syracuse Community Health Center was built for the community. I look forward to seeing new patients come through and get the best care.
And there you have it. The interim CEO, hopefully not long, for the Syracuse Community Health is Dr. Ofrona Reid, he's still, are you accepting patients? I guess that's the question. Are you
Yes,
accepting new patients? We should ask that
yes.
question. All right. Syracuse Community Health, a great partner with Inspiration for the Nation. Look forward to many more conversations with you, and we thank you for your support. And good luck, and we congratulate you on your new role.
Thank you.
Inspiration for the Nation.